Good morning, everyone. I think we're going to get started right now. This is Sohaib Ari from the California Rural Indian Health Board with the California Indian Tobacco Education Program. Today's webinar is going to be with Sherry. Sherry from the California Smokers Helpline. Just a heads up, again, this webinar is going to be recorded and will be provided to everyone who missed this webinar. We will also be sending your contact information to Sherry so she can reach out to you guys if there's any questions or you guys need any help with something. Today's topics will be the current client services offered by the helpline, the importance of providers' advice in helping a smoker quit, providing services and initiatives, and we'll also have questions and answers at the end. But you're more than welcome to ask any questions that you would like in the chat box, but I'll unmute everyone at the end so we can finish the webinar and ask the questions at the end. Our presenter today is Sherry, a partner relations coordinator with the California Smokers Helpline, the project manager for CDC-funded National Asian Smokers Quit Line, ASQ, a sister program of the helpline which provides smoking cessation and counseling to Asian populations. Sherry joined the helpline in 2005 as a smoking cessation counselor, where she counseled clients in multiple languages, including English, Mandarin, and Cantonese. In her current role, Sherry is responsible for publicizing information on and increasing awareness about the value of the California Smokers Helpline and ASQ and its services. She cultivates new partnerships with healthcare providers and communities throughout the California and shares information about the helpline services like she will be doing today. Since 2010, Sherry has also provided ongoing training programs like the ones today, which offer services to pregnant women and smokers with young children. This contributes to her over 10 years of experience in managing public relations with nonprofit organizations like CRIB and other tribes, healthcare professional groups, community-based organizations, as well as corporations. Sherry earned her Bachelor's of Arts in Communication from University of California, San Diego. With that, I'm going to try to turn this over to Sherry and give her the control. So please bear with me. Sherry, you have control?
Okay, I think I do. So, showing my screen.
Awesome.
So, were you able to see my screen? Okay, cool. So, well, first of all, thank you so much for inviting me to do this presentation today. It's a very honored, and thank you so much for the introductions. And I also want to welcome everyone here who took the time to join the webinar today. And I know Friday morning is usually everybody's ready to go, so I promise I'll make it short, and then so everybody of us can get ready for the weekends, and also July 4th is coming. Okay, so basically what I am going to do today is to share some of the exciting news and also the services provided by the California Smokers Helpline, and what are the different things you can use or you can capitalize it and help you to provide the services to smoking patients, especially some of the patients, if they do not know what are the available resources out there, then our information could possibly help you when you talk to them. If you have any other questions, feel free to let us know towards the end of this webinar, or just like Sohab said earlier, you can type your information or your questions on the chat box, and we will answer those questions towards after my presentation. So again, I want to begin by thanking our funders, the California Department of Public Health and First Five California, who make these programs possible, and to let California Smokers Helpline still be able to serve clients no matter where they live, where they are, or what situations or what are the challenges that may be they are facing, so that they are not physically available to come to the center, or if they're living in a rural areas that is hard to take the transportations or drive far away just to join the program. So 1-800-NO-BEDS It's a statewide quit line service. Everybody's what they need to do. It just, call us and then we can provide a service to them. And here is an overview of this call. And basically, I will give you an overview about the helpline services and what are the different things that we are offering right now, or what are the up and coming new stuff that the provide California Smokers Helpline is going to share with the group. And also we'll share with you what are the important um, of a provider's role and how you can help your clients to quit smoking and what are the different resources that you can use. And besides the resources that we provide, we also have trainings. So after this one, if you want to go into a more in-depth trainings, we do have the different kind of trainings available. And also want to share with you what are the other special projects that we work with the community partners and some of these projects that may benefit of the people that you work with. So I would like to share that with you, and then that will brings us to the question and answer part. Okay. So for the California Smokers Helpline Services, and we know that it's a free service, and then it's actually started in 2000, actually in 1992 by UCSD researchers. So back in that early years, we have started the program, and we also randomized like 3,000 clients and then divided them into three groups. And then one of them is the control group. And then the other group is like a group of people that they received single counseling. And then the third group is people that they called us and also they will receive multiple counselings. And then we have those randomized trials results that comes back. And then we evaluate it on the 3-month, 6-month, and 12-month. And then after the 12-month evaluations, we have found that people that they quit on their own, which we consider the control group, that we don't provide any services to them, besides just send them the materials only. We found that groups of people, they quit smoking like about 7 to 8%, and versus to people that even they just receive one single counseling, the percentage it's already jumps up to 15 to 17% quit rate. After 12 months, they are still staying quit. And for people that they receive multiple counselings, it does the best. They have the best outcomes, which means after 12 months, when we do the evaluations, they are still staying quit, and there are about 25 to 28% of these group of people, they are still staying quit. So we know that the counseling service does work, and it works very well, especially people they receive more support. So that's why our services is based on the results, and we also do follow phone calls with these clients to make sure they're doing okay. And then if they have any questions or things that they are concerned, we can address about it. And now our business hours is Monday through Friday, 7 a.m. to 9 p.m. and Saturday, 9 a.m. to 5 p.m. So for clients, if they could not really do it on the weekdays, we do open on Saturdays, and they can call us. Or when they call us after the business hours, they can always leave us a message, or they can go through that phone tree. There are different, options, and there are different tips they can listen to, or they can go to our website as well. So after they leave a message for us within 1 to 2 business days, sometimes if it happens on a weekend, then it's gonna be, 2 days after, then we will return their calls and to provide a service to them. And the exciting news is in this fall, Helplines is celebrating the 25th anniversary. So we know that for when Helplines, we can provide the services and we can going to be the 25th years old. It's actually everybody's efforts and to help us together. So we are working on a silver anniversary booklet, and we will put some of the previous things that happened in the Helpline, and we also will share some of the future directions and some of the testimonials from the field. And to put it together, when it is available, we will make announcement to everybody and to let everybody know that we are 25 years old and want to thank for all the partners that to help the helpline to grow. So this is some of the exciting news that I want to share with all of you. And then like I said earlier, all of our services, it's free. And 1-800 no but that is our English line, and we also have it in Spanish line, Chinese, Korean, and Vietnamese. And besides the phone services, we know that people, they are now more technology savvy and they prefer to do something online and they go check the information themselves. So we do have a new look of our nobud.org website. So if you haven't been there yet, I strongly encourage you to visit our website because it's not only designed for the smokers, but we also have the different sections that provide the relevant information to a specific groups of the people. So for clients, like I said earlier, if they do not if they are not able to join any of the phone calls or if they are not able to talk on the phone during that moment, they can definitely go to the website and they can check on some of the quitting tips. And currently, they can also submit their information online. Once we received it, our counselors will reach out to them and to talk to them. And there are also some of the fact sheets that talk about like how they can quit smoking without gaining weight or how can they cope with stress while they're trying to quit smoking. There are tons of different topics that interested to the smokers, and we know that those are the topics that a lot of times clients, they will bring it up during their counseling section. So that's why we make those fact sheets available online and for them to read it. And if during the calls they have no questions, our counselors will also send them these fact sheets so they can have something on hand. And local cessation programs, it's a list that are compiled by the local lead agencies. So in every different counties, we do have a list of the different programs listed there. So say in Sacramento County, if you go to the website and if you choose that local cessation programs and then choose that county, Sacramento, then the different local programs will be brought up, and then you will be able to check and see what are the other group meetings available because clients, they may want to have additional help. They may want to go to some face-to-face class or they would like to, have a group support meeting. So those are the good places that they can check out and to see what are the available resources they can use and they can, call and find out and join those programs. And then we also have text messaging program and it is on our website too. So what they need to do is just, put down their name and then their phone numbers. And then once they sign up for that text messaging program, we will send them some of the quitting tips and the helpful tips to help them to quit smoking. So the text messaging is more like for encouragement and if they want to have some kind of reminder. So the text messaging program could be another way to go. And then we just started our online chat last year. And so for the online chat, it's pretty, I want to show you that. Okay, so let me see. Okay, so we actually launched it last year, and then they can go to our website. So from this screen, you can see that there is a chat button, and then once they click on it, they will submit their information, and then they would also start chatting with our available agents, and then our counselors can help them to understand more about their situations, because sometimes people, they prefer to talk online, so this is another option for them. And we are still trying to evaluate why and when clients use the chat. And so far, we make it available during our regular business hours. So if this is off the business hours, then the chat options is not available. But we do have a chat options that are available during our business hours. And you can share with your clients if they prefer to do something like online, maybe as an entry point to start thinking about quitting smoking. It could be another place to go. So let me just go back to the slides. Okay, so these are the self-help materials that we make it available on our website too. So the clients, they can choose it. The design guide, it's a booklet. We send it to the clients. So when your clients, they call us, after they finish that intake, and if they do not have a plan to make a quit attempt within the next month or within a month, then we will send them the design guide. So you see a big question mark on the cover. That means we want to help them to start thinking about the importance of quitting smoking, and also we want them to start to know that they are able to do it and to help them to go to that decision to say that, oh, I'm willing to quit smoking. I am going to give it a try. So the design guide is actually designed it for people that they haven't thought about quitting smoking in any time soon, but somehow they just want to see what is available and what are the different things that they can use. So we do have that booklet. And then we do have another booklet. It's called the Tick Control Guide. That is for people that they know they want to quit smoking, they're motivated, and they want to quit smoking within a short period of time. So that one we focus more about on the strategies and the different things they can do to make their quitting smoking journey easier, or to set right expectations. So if I a lot of times the providers, they do ask me, I have patients or I have clients, they don't sure what they are doing and they don't feel that they want to quit smoking. They just don't ever think about it. So did you think that I should still give your number to these clients? I would say yes, because we never know when they are going to make that things happen, or when they are making that decision saying that I am going to quit smoking. But what we are hoping is, if you give them the materials or the resources, the numbers, or the programs information, when they are ready, they already have this in their hand, and then they would know, oh, I remember my doctors gave me this card, or I remember somebody have gave me this brochures before, or I have this number, then I'm just gonna, make a phone call and see what happened. A lot of times when the smokers, when the callers, they call us, they have explicitly tells us that they have no interest in quitting smoking. They just want to call and get the materials. And it changes. And maybe towards the end of the calls, when we offer them, did you want to talk to our counselors? They may feel that the way they, communicate with the counselors during the intake call changes their thoughts, and their experience change, and then they will be like, oh, okay, let me just talk to the counselors. And then it could help them to alter their thinking. So always give them the available resources to equip them, let them know that if they are willing to quit smoking, here are the different things they can try to use. And so for the individual telephone counseling, we have one pre-quit call. So after that intake call usually takes about 10 minutes, because we want to be sure that to know what are their statuses and to provide the best information as we can. And then the pre-quit call is like the information call, get to know them, what are their smoking history, what do they like about smoking, and what would they miss, or what are the triggers and things that they feel like if they are going to quit smoking. And these are the moments, are the toughest moments, say, hanging around with the smokers, that makes them just always want to go back to smoking. We will talk about those kind of difficult situations, and then to facilitate the counseling and to help them to think about what are the different ways or methods or the styles they can change, so they can avoid the temptations and also the triggers, and to hang and to stick with these kind of plans. And so the pre-quit call usually involves those kind of strategy analysis, and then to talk about their history and let them talk about how do they feel to quit smoking, or what do they miss, or if they have questions using like quitting aid like the patches or the nicotine gum, we will cover that on our info call too. So after that info call, if they set up quit date, and we will do follow-up phone calls up to 4 relapse prevention calls. So the relapse prevention calls are designed based on the relapse sensitive curve. Like the studies that we have done when we started the programs, we know that the first week usually people, they will easily go back to smoking, because that's the first week that they have to change their lifestyle, they have to change their strategies, and then they're experiencing the withdrawal symptoms. So there are tons of things that could interfere their mind, and then they could, easily just to go back. So we know that the first week they need the most support. So usually the first week we will schedule more calls and to talk it through and to help the clients to go through that toughest moment. So usually the first week of the quit day are the toughest moment that we will provide the most call. So besides clients that they are over 18 years old that we will provide the services, we also have specialized protocols for teenagers. So anyone who are 13, let me see, I would say 14 years old, uh, 14 to 17 years old. And if they call us, we are still able to provide the services to them. If they want us to call them back, like to provide the follow-up information or the follow-up call, then we will need to get a verbal consent from their guardian. But if the teenagers they have issues about smoking, they can call us and we can help them with it. And we also have specialized protocols for pregnant smokers and for people that they are having a babies and then they want to quit smoking, but it's just hard for them to do it. They can call us too, and we know the situations is different. So the protocols we will gear more towards what is the best things they can do to provide a better life for the babies. And then for people that they are not smokers, but they are using smokeless tobaccos like a chewers, they can call us as well. And we have Asian language smokers. For those clients who speak Chinese in Mandarin and Cantonese, Korean and Vietnamese, they can call us. We have the counselors who speak these languages to help them. And clients that are not smokers, but they want to help the other ones to quit smoking, like their friends or family members who are the smokers, they want to help these people, they can call us too. We call these clients proxy callers. So we provide the materials that they need and to help them to be more capable to talk to the smokers and to know what are the right strategies they can use to help the clients to quit. And we talked about it earlier. So for the first pre-quit call initial sections, usually it takes about 20 to 30 minutes. And during this call, we want to be able to build up the confidence of the clients. We want them to know that they are able to do it. It just takes some time, and a lot of times they don't realize that they can do it. They feel like, oh, they get hooked on something, and then they just cannot get it off. But we want to let them know it's possible of doing it. Try to think about before you know how to smoke, you are non-smokers. So it just we have to unlearn something that we have learned, and to back to the point that where they are not as smokers before, and then help them to come up with individualized plan, and motivate them to make a quit attempt. Because we know that for everything that we have talked to them, we make plans, we let them talk about their feelings on smoking, and at the end, if they just feel like they don't want to quit or they don't put works into actions, everything is just on papers. So we want to motivate them to think about to having a serious quit attempt. And we provide follow-up sections. For the follow-up sections, usually it's shorter. We do check-in calls like to know about have they started quitting smoking? What are the difficult moments that they are experiencing, or do they feel that they are they do they have any questions about using the patches, or do they have anything that they don't want to talk about? Even for clients, when they tell us that they try to quit smoking, but they go back and smoke for 1 or 2 cigarettes when they were hanging out with their coworkers, and we want to let them know, hey, if this is what happened, let's talk about next time if you're being around with your smoking coworkers again, what would you gonna do? We will change the plan and to help them to get back on track and to continue that quitting smoking journey. We don't want them to feel that they are the loser, they failed of quitting smoking. We want them to know that even though they go back to smoke for 1 or 2, and then if they're willing to continue to keep on going to quitting smoking, that's still okay too. So I have a link here for you to listen to a simulated counseling calls. So this is the recordings that are composed by one of our counselors, and also we have another client that pretend they are the clients, and these gives you an ideas about how our counseling calls go. So this is the link. You can click on it, or you can go to our website to listen to it too. So that way, it helps you to know more about what we will cover. So in case your clients, they ask you, oh, when I call the helpline, what's actually going to happen, then you would have some ideas about what is it. And the benefits of telephone counseling is like it's free and they don't need to give any fee or anything. It's totally no cost. And then when they call us, basically they just need a phone. They don't need to worry about their transportations or childcare. And it's a one-on-one telephone counseling. And we want to make it personal. We want to make it like we give all the attention to just one person. So it's not a group settings. It's a one-on-one counseling. So for the clients, they can feel free to share their information with us or things that they would like to talk about. So for the telephone counseling, it's easy for them to access. And so we are actually always looking for the different options that we can provide the nicotine replacement therapy to our clients and looking at building relationship with pharmacies or pharmacies benefits management systems, and we always want to look for the different parts, different opportunities of, providing these free patches to the clients. And so far, there are 3 projects going on. One of them is we provide a 2-week starter kit, the nicotine patches, to our Asian-speaking clients who speak Korean, Vietnamese, Cantonese, and Mandarin. And then for the first 5 related groups, first 5 they fund Helpline last year, and we can start giving out the patches to clients that are pregnant smokers or if they're the smokers with young children 0 to 5. And they can call us to see if they're eligible. And for these clients, if they're eligible, then we will send them the 2-week starter kit directly, and they don't need to get a form and then go to the drugstore and get it themselves. So we send these products directly to their house. And then let me go to the next one. Okay, so the text messaging program, we started earlier to talk about that they will receive the daily text during the first important weeks of quitting, because we have information to tell them that, to ask them to put on the quit date. And then we also have the messages that pinpoint some of the critical things along the way, and counselors respond to questions within 1 business day. So if they do have questions, they can also send us the questions or respond it to the text messaging system. We started the texting program back in 2013, and then last year, the entire 2016, we do had about 618 users, and then early this year, from January to March, we have a little over 200 users that have used this service, and we actually projecting we will have more users this year. And especially after March and April, we know that they learn the secret text has been increased. We get more people to call us to send a text messaging and also to require about the services and wanted to, started to quit smoking. We have talked about chat, and then I also want to share these charts with you. It's the helpline call data from 2012 to 2016. So basically what I am showing here, the orange line, that is the all callers who call from California to the helpline during these 5 years. For 5 years. So what we are showing here is we can see the trend of the calls that we have, quite a lot of calls coming in anywhere from 2014 to early 2015. That is the time that we know Medi-Cal, they have provided the free nicotine replacement therapy to their clients, and also they have the incentive program that is going on. So we do get a lot of phone calls during that time. And then the blue or greenish color of the bar, that is the number of American Indian and Alaska or Alaska Native to call us during that time. So I pulled those numbers for you to take a look of it as well. So we can see that, there are really a lot of calls coming in between 2013 and 2015. And one of the reasons to contribute to these calls is because the Medi-Cal incentive program. And then the other thing is there are some promotion going on, so that encourage the clients to give us the phone calls or motivate them to make the serious quit attempts. And because of that, we know in the nicotine replacement therapy, it's gonna help them. and it's also give them an additional motivations for them to make a quit attempt to quit smoking. And then the cost getting lower after 2015, and because in 2015, I remember around summertime, by the end of July, that program's gone. And then we have less, the calls, we can see that it took a dip, and less people called in during that time. But probably when we are ready for that 6-month reports for 2017, we can see that bump again because, the tax increases, people, they're more interested in quitting smoking. And for these informations, it's public and you can access it yourself. And this is the web page looks like when you go to the nobuds.org website, and you are able to, access these informations. So I'm just showing you a portion of the reports, but besides telling you who calls the helpline, but we also have the information divided by age group, their education background, and whether they're pregnant or not, and the language that they speak. So we do have that information. You can go to this page and to take a look of it. The latest 6-month call reports will be ready by next month around July 15th. So you can always go back here and check it out. And we all know that smoking is bad and it's major contributor to poor health. From all the information we have seen, or for a lot of news we have heard, we are always being told that smoking is bad, and we want to help the smokers to quit. And we also know, it's the leading cause of preventable disease and death in the U.S. And we know it's not, it's something that we definitely want to do more and to help them to quit smoking. Good news is in 2014, we can see the current smoking rate has declined and to 16.8%, but still there are 16.8% people that are smoking. And it really relies on a lot of you out there to help them to provide the cessation advice to your clients or to your patients. And the reasons is your role so important. It's because you see them more often, or you know them better because you see them from they come to you and they see you as like a healthcare providers and or health educators to be able to provide information to them to and a lot of times we have seen that smokers advised by providers to quit were nearly twice as likely as those who did not receive such advice to want to stop smoking. I do have other information, but I didn't have it on these slides. It talks about for the pregnant smokers or for the parents when they take their kid to see the clinicians or to see the pediatrician, if the parents, one of them or both of them are the smokers, when they see the pediatricians, even though that doctor visits, it's because of the kid, they expect the doctor will tell them something about quitting smoking or will give them some information about quitting smoking, because they know this is not good, smoking is bad, and it's also bad for their kids. And from some of the survey that has been done, it shows that 1/3 of the patients, if they are taking their kids to see the doctors, they would feel more satisfied and they feel it's better if the doctors can also address their smoking issues and status. And from that, we know, smokers, they expect the doctor will tell them something about stop smoking. And you can also use that visits as a teachable moment because during that time, they are there to getting what you are giving them. So you can let them know, hey, if you're smoking, if you continue to smoke, it is not good to yourselves. Or if you quit smoking, you actually can do better with your health and also to have a more healthy lifestyles. You can use that as a teachable moment, and then for the rest of the stuff to help the clients to quit, make the plan. Our staff will be able to help the clients to do these kind of things and ask advice and refer. And we probably ask all of our patients, do you smoke? What are their tobacco use status? And then once we found that they are smokers or they use tobacco products, and you can simply just tell them it's important for your health. And think about to make a quit attempt, here is a 1-800-NO-BUTS the card for them to call, or you can give them the brochures, show them the website, or you can even help them to register themselves online to submit their information. Instead of calling us to do all the intake information, they can also do it online. And it gives you an option to help your clients to finish that as well. Once you submitted that online form, and our counselors will call the clients within a day. And then, so another thing is, if they do not want to do anything during that moment, you can tell them, call 1-800-NO-BUTS, and your chances of quitting will at least double. And so these are some of the information you can share with the clients, or if you prefer, we also have something that is called web-based referral program, and I'm going to get into it later. So that is something for you to use you can register your clinic, hospitals, or your agency on our website. Once you are in our system, every time you can just go to that web page and then just click on the name of the clinic or the organizations that you're associated with, and then you can just type in the patient's information and ask for their verbal consent. If they said, yes, I would like to give the permissions for the helpline staff to call me, you check that box, submit it to us, and then within 3 business days, we will contact the clients too. So that way you are making a proactive referral, refer your patients to the helpline. The good thing about using the web-based referrals, it's you catch that teachable moment and a golden opportunity. They may be motivated when you talk to them, so you can catch that moment and then refer the patients to us. And if they are not interested in doing any of these kind of things, you can still give them, the brochures, or, have them to call us. But sometimes the patients, they are motivated talking to you, and if you can catch that moment, it's actually better. They won't forget. They won't be like, oh, I don't want to quit anymore. So if you can catch that moment, refer them online, I would encourage you to do that. The other thing is, after 6 months, you can also let us know, and we can provide you a report to let you know how many patients you have referred to us during the past 6 months. And then among these reached population, how many of them they have been enrolled to the counseling, or they choose to receive materials, or they refuse the service. So you would have an idea about the efforts you have made in the past few months, and how many patients you have helped them to quit smoking, and how many of them actually, go to the different services, or they refused it, or whether the numbers of no contact is high. Is it because the information we have got it's incorrect, things like that. So for the web-based referral programs, it's also helped you with your smoking cessation education efforts too. And usually, I want to let you know, it takes about 10 to 12 quit attempts to let the client, I mean, for the smokers, usually it takes about 10 to 12 attempts before they can quit eventually. So this is the number, it's kind of discouraging. So I don't want you to share this number with your clients if they're telling you this is my first time to quit, and then you'll be like, oh, sorry, you still have 9 times. So no, this is the number that it's more like for us to know every time they are making a quit attempt, it counts. And the more quit attempts that they make, it's going to help them to become quit for good, become a non-smoker successfully. So this is the number that I want to let you know. So they go back to smoke, it's very normal. Even though they said they are going to quit, they quit for a few days and then they go back. It's normal. But we still need to encourage them, give them the support. And that's what we told the proxy clients too. Nagging them is not the best way to do it. Show our support and encouragement to the clients to let them know they are able to do it. We are not being in a judgment position to judge them, hey, you are doing bad, or we don't want them to have that kind of feelings. We don't want them to go through the guilt trips. What we are trying to do is we are here to support them to quit smoking successfully. And then, so like today's the webinar online trainings, we also have the different topics on the website that are available, that we make it available for healthcare providers and also behavioral health providers and for smokers as well. And these are some of the topics that we have put together for the past year. So maybe these are some of the information that you're more interested in, and you can click on it. We have the recorded webinars, and it is available on our website. And we have the presentation slide stack that are available, and there are some information. We have the online digital versions. You can download it, and you can bring it with you. We have the top 10 quick tips, and the top 10 quick tips, usually the clients will find it useful because it gives them an overview of the different things they can try, even though they may not want to quit smoking during that moment. But when they see that top 10 quick tips, they will be feeling, oh, it's not really hard to get started, and there are something that they can try to change their routine a little bit, and then at a point they are able to quit completely. So we do have the top 10 quits to quit, top 10 tips to quit webinar available, and we have the resources available online too. And there are some toolkits that we have developed for the providers, so you can check it out on these websites. And if you sign up on our Helpline Updates newsletter, every month or every quarters when there is a new webinars coming out, you will get the notifications too. And the provider referral options that I shared earlier, and we have two types of referrals. One of the type is a web-based referral that I told you earlier. It's free, and let me show you the fee here. So it's free, and you can just go to our website to register your organizations, and we will provide the aggregate referral dispositions report to you. And there is another two electronic health records referrals that you can use, and that one we have some overhead cost and a setup cost for it. And it varies. It really depends on what kind of electronic health system that the agencies is using. So if you're interested in these options, you can send your online request form on our website, or you can send it to these email meaningfuluse@ucsd.edu, because this one is considered the meaningful use if you register your organizations and use the direct or internet protocol. But there are some of the more specific technical details need to find out. So I suggest if you are interested or if you want to know more about these ones, do go to our website and submit your request, and we will have our project manager, Carrie Kirby. She oversees all of these electronic health records referrals program, and with our IT managers too. So that brings us to the special initiatives and helplines. We always look for the different ways to provide a free nicotine patches, and ASQ, that is funded by CDC, and is a free telephone counseling that we provide for the Asian speaking clients, especially speaking in Chinese, Korean, and Vietnamese. And for these clients, when they call, it's a nationwide program, so it's not only in California. So for these Asian speaking clients, if they want to seek out a service, if they live in other states, they can call us too, and they have the different language line numbers. And then when they call us, we provide the services to them, and they will also get the free nicotine patches. And we do also send them some self-help materials. And the contact person is me, so I'm wearing the other hat that's also helping with the Asian Smokers Quit line. And we do have an other partners that her name is Josie Marvin. She's a doctor in up North Bay Area, so she provided trainings to pediatricians or to OBGYN providers, and to let them know the importance of helping the patients or the parents, to pregnant smokers, and also the parents of patients to quit smoking. So for these first 5 funded projects, the helpline also get funded to provide free patches to these eligible clients. So if your clients, they are fall into one of these categories, like they are pregnant, or if they are having children 0 to 5 living with them in the same household, have them call us, and we'll find out if they're eligible. The reasons that they may be ineligible, it's because it could be the health conditions that they have. So that's why they have to call us, and then to find out what are their situations. And but I would say that for pregnant smokers and smokers with young children living in the same household, if they called us, at least they would fall into these categories and they may be eligible for getting the free patches from us. And then the First 5 California, we have the free telephone counseling for them. That's of course. And then we also have a particular materials that for these patients and red cards and also like small business cards that have the number in Spanish and English versions. And Kristen Harms, she is the person who is in charge for it, and her contact information is here as well. And so this is the page that concludes all our materials in here. And then earlier when I was talking to Sohab, we were talking about how to order more of the materials, and I know it could be a little bit confusing for some of the things that you can order on our website and then some things that you have to order somewhere else. So we want to make it easier for all of you. You can always go to the nobeds.org website, and then on there we have the we divided things into different icons, and then you can just click on that one. And then so I would suggest you go to the nobeds.org website as an entry point, because they will redirect you to the tech website if things that are not fulfilled by us but fulfilled by them. So that is the way that you can see everything. Even for the Asian Smokers Quit Line materials, you can just go to the Nobeds website. So I would say that go to nobeds.org as your entry point to take a look of all the materials and click on those links. And if you still get questions when you're trying to order materials, which I know it could be frustrating, contact me and I'm more than happy to assist you with that one, and then we can work it out. So that brings it an end to my presentations, and I think we open up for questions now.
Hi everyone. I'm going to try to unmute everyone so you're able to ask questions. And if you are not able to ask questions using your mic, you're more than welcome to use the chat box, and I can read the questions over there. You can also send me questions in private, and I can also read those questions. I will also start up recording in about 5 to 10 minutes, so you can ask questions in private if that is something you want. So we have a question, Sherry. Can you talk more about what to expect when a smoker or a friend calls the 1-800 number? So I think they're trying to figure out what would be, the whole procedure and what to expect when, that call is made.
So the caller, it's not the smokers, but the caller want to help someone to quit smoking, right?
Smoker or a friend. So it can be the smoker or a friend. So I guess you can talk about both ways and how it can be different.
Okay, so for smokers, when they call us, they will still need to go through the same intake questions part. And then, so for the smokers, we ask them more about the smoking histories or how many cigarettes that say they smoke every day. And then do they have any plan to quit smoking within a month? And also because we want to provide the nicotine-free patches to some of these eligible clients, we do have some health questions that would ask them whether they have heart disease, high blood pressures, or other health concerns that we need to know. And besides the cigarettes, would they use any other kind of things? So it's more the part that has added to the smokers part is the health conditions part for the smokers. And then the materials that we send them is the quit smokers booklets. For the proxy clients, which is the clients that are not the smokers but they want to help someone to quit, of course we won't ask them about the health conditions, and we won't ask them about the smoking status. I think we would just ask them, did you know whether they are still currently smoke? That is the questions that we will ask, or the most we will ask another question, did you know how many cigarettes that he or she smokes? So these are the questions. So for the proxy clients calls, it's shorter, and the materials we will send them, besides the smokers quit smoking booklets, we will also send them another booklet that's designed for proxy clients and talks about things they can do to help the clients to quit. And they won't receive counseling because we don't have a service that is for the proxy clients to do the counseling. But we do offer the counseling options to smokers if they call us at the first place.
Thank you, Sherry. We have another question. So they're trying to ask can we get the handout type information on website if you're not a clinic? So I guess non-clinical organizations.
Like the fact sheets, or what are the?
I think they're talking about all handouts, so brochures and fact sheets and all that stuff.
Oh, sure. So it's available for everyone. We just separated them by categories. So if they know what kind of information they get, they can do a quick search and then it will pull us up to them. But if they do not know which particular one they want to get, they can browse through all of these materials and then they can, order it online.
Thank you so much.
Or download it.
Yeah, that makes sense. Thank you so much. As people are asking questions, I'm going to ask another question. So is the helpline able to see if the smoker or was trying to quit called multiple times, or if, are you able to provide us with that information?
Which information?
So if, for instance, if the smoker is calling one time, or if the smoker is calling multiple times, not personal information, but just to see if there's a population where smokers are calling more than once, or do you guys not record that information?
Let me see. Okay. For our clients, when they call us, all of them, they need to go through intake. And then once they have been in our system, whether they chose to quit smoking or not, they are already in our system. So let's say for some reason they chose not to receive counseling during the first call, then of course we just send them the materials. We cannot provide counseling to them. But within 13 months, if they call us back again and they want to register and do the counseling, then we can provide the services to them. And during the counseling call, for some reason they do not quit successfully and then they want to call us multiple times and do that, we can definitely provide the services to them. Whether we have this information, I think we have these informations, but the way we generate the reports could take longer time because once the clients, they are in our counseling protocol, it's not like a database. It's more like how they are, checking with the clients, things like that. So we certainly have those information, but it's just the way that we need to generate the data. How many people they have called us multiple times may take longer time to generate those numbers, but we do have those information.
That makes sense. Thank you, Sherry. Are there any more questions? Again, you're all unmuted, so you're more than welcome to speak, or you can also send messages in chat, or just use the question section on this outlet, and then you can also ask questions that way. Looks like we're not getting any more questions. I'm going to stop recording. Thank you so much for everyone for joining. You're more than welcome to stay and ask questions in private after I stop recording. All right, I'm going to click stop recording now.